So I'm here with Matt and Gordon. Gordon, if you'd like to introduce yourself.
Hi, I'm Gordon. I've been a doctor for about 7 years now.
Okay, and yourself, Matt.
Yeah, I'm Matt. I'm a physiotherapist. I've been for about 9 years.
Okay, great. So we're here to kind of help and support carers. So in terms of the hospital, what kind of challenges have your colleagues and carers come up against during COVID?
It's mainly the problem with carers actually getting to the hospital and getting the information that they need to really be empowered to look after their loved ones.
Okay, great. And yourself, Matt, because you kind of work with the hospital staff as well, looking at people when they come to, being released back into the community to go home and be safe. What kind of challenges have you kind of seen?
Yeah, so physios do have quite a big role in discharge back into community services. And obviously with COVID and the kind of limited amount of communication, that personal communication with carers, it is a little bit more challenging to hand over to those carers in terms of what they can be doing at home. And obviously the patient will be transitioned from a ward-based setting back into the community. And obviously keeping up that progressive rehabilitation they've had on the ward is kind of crucial in those early stages.
Yeah, of course, great. So just to walk me through it, so if I came into hospital and I'm on the ward, and obviously you've got carers, like my mum, for example, might be my carer, comes in to see me on the ward, and then it comes to now I'm okay to go home, but I need additional support. What does that look like?
Yeah, good question. So if you're in a ward-based setting, you would be monitored from doctors, physios, nurses, and then you tend to have a more specialist team like a discharge service as well, a discharge nurse who kind of coordinates a lot of the discharge process. So a typical patient would work towards the discharge, which would look at improving mobility, getting a handle on their meds, and being able to monitor pain, those sorts of things, up until the point they can be discharged. And then we then hand that information over to a community team, so that would include another physio team, an OT team, a nursing support team, and kind of bringing in that carer's role as well is ideally you'd want to empower the carer to be able to continue the rehabilitation process and the support process that the patient needs for when they move from a supported setting in the ward to back at home again.
So that support would actually now come from the actual carer, and then you review that's key points.
Ideally, yeah, that's what you'd want. Yeah, from a physio point of view, you'd want to be able to hand over crucial pieces of rehabilitation points and topics and empowerment to the carer to be able to support them to continue their rehab.
And does that go down into other services that they can bring into the system, other products they might actually be able to use? So for example, if you had a muscular injury and you have a rehabilitation program that's supposed to do a particular exercise daily, you can set them on a program and make sure that carer is aware of what that process should be.
Exactly, yeah, that would be the best process, yeah.
Okay, fantastic.